a number of items which we would wish to go through from a point of view of the board having an understanding of some of the action plans that had been created, and we need to take, as you know, the safeguarding reports both from adults and children's. Unfortunately, Christine Davis is not able to join us today, and that discussion will be delayed until later. But we do have with us Mary Seaton, who is the chair of the Adults Board. And Mary, to you.
Thank you for inviting me.
Yes, that's it.
Okay. I am not proposing to go through the annual report because, as you will see from the dates, we have moved on considerably. But what I'd like to focus on very briefly is to highlight some of the preparatory work that has gone on and the fact that the Safeguarding Adult Board is in a position of being fit for purpose for becoming a statutory board from April 2015. You'll see in the report there is reference to some strengths. One of those is the engagement of service users and carers. That is critically important because the Care Act puts at the heart of what it says, that individuals need to be empowered. There is a strong emphasis on prevention and well-being, and looking at personalisation and the outcomes and experiences of individuals. So within Northamptonshire, it predates the Care Act. That has been the direction of travel for the past 2-3 years. So in terms of being outcome focused, you'll see in the report that Northamptonshire has been part of the Making Safeguarding Personal. We have a very strong and committed and enthusiastic service users and carers subcommittee who have actually been very influential at one of our recent boards. They made a proposal that NHS England took away and resulted in improved practice in the particular set of circumstances that they raised. The second area is around governance arrangements. The Care Act requires that there are statutory partners form the core membership of the board. That's the police, health and the DAS of the local authority. There is also a requirement to produce and publish a strategic plan through engagement with communities and in consultation with Health Watch. And there is a requirement to produce an annual report, whereas that wasn't a requirement previously. So there has been a review of governance arrangements. New strengthened arrangements are being put in place, partly to deal with some of the challenges that are highlighted in the report around capacity, around how all partners around the Safeguarding Board table are stretched. So we've actually revised the governance arrangements for the board. I think in terms of the work of the board, this board can be reassured that learning from serious case reviews, from Winterbourne, from other high profile national cases has all informed the improvement in practice in relation to safeguarding adults in Northamptonshire. So on that basis, and moving forward to April 2015, I felt it's important to keep it brief, but I'm happy to take questions.
Mary, thank you very much for that. A couple of questions from me, first of all. Clearly, the date of this report it's way out of date now. What's the plan for the future? Will, in fact, you have a report available for the June meeting of next year, or will it be September of next year?
To explain why it's so out of date, the Safeguarding Adult Board is a collaboration of all partners, and the annual report is both prepared by all of those partners and goes through various governance arrangements. In going forward, we are already planning to be aligned with other governance processes, both with this board, with council, with trust board. So it will come a lot earlier next year.
Fine, thank you. Any questions? Will?
Thank you very much, and thank you, Mary. Thank you very much for this report. We welcome it and look forward to the next, of course. Could I just say that we particularly welcome the public engagement commitment that's in there on what's particularly on page 5, third paragraph up from the bottom. That's really great. So very supportive of that, and thank you also for the engagement with Health Watch and the way that's working. So thanks for that. All I think we look for is assurance that that commitment will continue post-statutory.
Yes.
So with that assurance, totally supportive.
Yes.
Thank you.
And I can give that assurance.
Fine. Adam?
Hi, I'm the Police and Crime Commissioner for Northamptonshire. And one of the things that's really interesting for me is understanding the police have a great kind of tick box in here of things they've done. HMIC sort of ratified and very congratulatory over some of the training. As the independent chairman, I would be interested to know what you think we should be doing next. Rather than concentrating on best practice today, what's the next practice?
I think there are two immediate issues. One is to resolve the membership at the board, because there was a move whereby the representative became the representative of police and fire. So we need senior representation from the police. That had been there previously, so it feels that it has been a step backwards, and that's really significant, because so much of the work, in response to the second part of your question, will be around areas like domestic violence, and we need to ensure that we've got clear engagement with the police in looking at future arrangements, whether it's multi-agency safeguarding hub. But I think to have that engagement when we will be preparing the next strategic plan and priorities is critically important.
Does that help?
Thank you. It does help in terms of the representation of the board as is right now. So I guess what I'm thinking about the next time we have an opportunity, or maybe we can just meet offline, is to understand what safeguarding vulnerable adults looks like tomorrow.
Yes.
So there's a lot of work of getting to a position where maybe the public would have thought, well, why aren't we there already?
Yes.
And that's probably safeguarding children and adults.
Yes.
But really keen to know what your thoughts might be about the future, the next 5 years, 10 years.
I'm
that
very
kind of.
happy to have.
Is that all right?
Yes,
Can we arrange that
really,
offline? Thank you very
absolutely.
much.
Thank you for that. The other point about safeguarding, you did mention the issue about children. We do have with us Alex Hopkins. Perhaps, Alex, you'd like to make some comments about safeguarding and, in particular, the developments from your perspective.
Yes, a couple of things. I think the first thing to say is we're working on the connections between the two safeguarding boards. So that's both in terms of the accountability of both chairs together, particularly into the local authority, but also the two, looking in the new year for the two boards to meet together to make sure we establish those firm connections. Because obviously the children who I'm concerned about live in families and communities where there are adults, where there may also be safeguarding concerns. Just briefly, in terms of the Children's Safeguarding Board, our improvement work continues, and there's been great engagement across the partnership. A number of you are lucky enough to come along to the improvement board either on a monthly basis or as and when. And a wide range of issues have been addressed, and we've still got a lot more to do. We're actually now halfway through our statutory 2-year direction. And on the back of that, we did have an Ofsted inspection a few weeks ago, which went well, and the outcomes of that, the report, will be published in the new year. I think it's also worth saying that it's worth referencing the County Council budget, which also recognises very significant increased demand in terms of children's safeguarding. And I suppose the only other thing to say is the LSCB report, which is published, we'll make sure a link goes into the minutes so that people can find that and have a read.
Thank you very much. That would have been on the papers. Do we have Heather?
Yes, thank you, Chair. I just wanted to add a little bit to what Alex has just said about exactly where we are with children's services. Following the Ofsted inspection that he's already referred to, we are well aware that there are still a number of areas that need to be strengthened for us to get to the situation where we are released from the direction notice. So there weren't really any big surprises in there, but some of the things that I am very conscious of, one is that the early help, which we were criticised about, is still nowhere near good enough. As a result of that, our number of referrals coming in remains at incredibly high levels, which means that the staff are being diverted to look at all of these cases instead of focusing on the children and families who are in the most difficult situations. So that still needs to be addressed. With the early help, we know that in places like Lincolnshire, where they have very effective early help, there are far less numbers of children having to come into care, that if the help is given early enough, then it's in the interests of the families and the children and all of the services involved. So that is something that we need to put a lot more focus on. We keep giving training and you keep telling people over and over about this is what you need to do, but we still get people saying, I didn't know, and I didn't know that was how I needed to refer. We have had some new contracts that came in over the last few months, all to do with early help. At the moment, there are some changes being proposed by the provider of the Children's Centre that covers 9 of the areas in the county, where they are proposing some changes. Their contract specifies that they need to concentrate a lot more help on those families that really need the help rather than the generic help. There's £10 million contract there. There isn't any extra money going into that service, but they are having to concentrate their efforts more on helping people in their homes rather than concentrating on running sessions in set buildings. So there's a consultation going on that at the moment. It does need to bed down a bit. A number of the staff that worked in that area before, although they were being tupied over, a number of them have chosen not to stay. So there is a settling down process that we are actually going through at the moment. But I would expect to see some significant improvements over the next few months. But I think it's important for all of our partners to really be clear about what can be done to help families at an early stage, that it shouldn't be an automatic response to refer them straight into social care. We have got all sorts of organisations involved out there who can give help and advice, and really what I don't want to see is partners not cooperating because they don't want to fill a form in. What we need is evidence all along of everything that's been done for each child by each partner, so that there is, when we are inspected again, whichever body is inspecting, whichever organisation, that there is very clear evidence there of everything that's been done to try and help a particular child. So there's a lot of work to do, but for social services in the County Council, it's a huge relief to have got through the latest inspection, and I really pay tribute to all of our staff who were under a lot of pressure during the build-up to them coming and during that period of time. But it's actually so far so good, or so it seems to be, but there's still a lot of work to do. Thank you.
Heather, thank you for that. Obviously safeguarding, Graham and Carolyn. Yeah.
In reading this, which reflects a lot of progress in the year, clearly, I was. And this is a real layperson's question in terms of I'm not quite sure what sort of procedures we have in place in the county, but I was surprised by the data on page 35 of this report, whereby one of the lowest categories of settled cases was actually sexual abuse cases. And given the awareness, shall we say, of people to matters of sexual abuse over the last couple of years particularly, I'm just wondering whether we are completely alert as a county to the risks of this with vulnerable adults and indeed vulnerable children, as you know, in the Rotherham experience and various other areas of the country, and I've seen it in the courts particularly, is that there is more reporting going on, generally speaking, and you'd expect an increase in these numbers of cases going forward. So are we alert to it? Have we got our ears open? Are we trained to actually identify this stuff?
I think in terms of the safeguarding team and the training of staff across the whole system, there is an awareness. I think in terms of what we have here, it links with the point about what will the future look like. I think there is still a lot of work to do about increased awareness that adults can be sexually abused as well. So I wouldn't want to reassure or to be complacent and say, no, this represents the situation, because I think the public awareness, staff awareness is something we still have to keep working.
Thank you. Carolyn?
Thank you. That really echoes what I wanted to say, is that we do appreciate about vulnerable children, but those vulnerable children become vulnerable adults, and when they get to us we have a capacity issue, because if they've got capacity to make a judgment, then we deal in a different way. So I'm really pleased that the board's going statutory, and we have done a lot of work. So one of the key things that Marie didn't tell you is that through our working with our user group is that we have a family liaison type officer, the first to do that, I think, in a safeguarding board, who works with people that are going through a serious case review. And we do learn from our serious case review, and I'm looking forward to the board going statutory, because we do have commitment. In fact, everybody turns up to the board. In fact, there's quite a lot of people turn up to the board. I just wanted to echo that actually we do pick up the children's bit of the world at 18. They do. When they do rock up to us later on in life, then we do get some problems.
The final point, Alex.
It was just to pick up on the children's element of that. So these figures relate to adults. The numbers in relation to children, as you would expect, are far, far higher. I think it's important just to say we make sure we record allegations of sexual abuse differently to allegations of child sexual exploitation, because the two things have a different profile, and actually the perpetrators have a different profile. We've been working very closely with colleagues within the police to make sure we're absolutely all over it in terms of issues like were found in Rotherham.
Thank you for that. Marie, thank you again for your presentation, and no doubt we'll see you in the meeting in June.
Yes.
Thank you.
Thank you very much. Thank you.
Any other queries? No. Fine. Okay, if we could now move on to the item which is noted as D2, the Interpersonal Violence Strategy Action Plan. The report has been produced. Adam?
Thank you, Chairman. So the report is as is. I don't propose to go through it, other than turning to 2.1 in terms of the money. I understand someone might want to say something about the CCG contribution, which has a no against it right now, but I'm hopeful someone's going to say something different about that in a second, maybe Ben. I would like to just also add, as I understand from Andrew, that we're in the throes of agreeing an approach to hostel care, which is going to be a county-wide approach. The districts and boroughs are looking to have a view to sort of emergency care, which is holistic. So we're able to look at all authority care, homes and accommodation rather, and do it. If someone lives in Wellingborough but there's space in Daventry, we can do that through a partnership arrangement, just make that happen rather than worry about there's no space in a particular geographical area. If we can achieve that, I think that's a huge step forward for all sorts of reasons, and it means we're good for another year when we go out to tender for all these other services that we're looking to. So I think that's great progress. On the money, I'm hopeful Ben can say something.
Ben?
Sure. Yeah, no, I read the paper actually, and it did read as if the money might not be coming from health. But just to confirm,
have we got a feedback on or do I need to turn mine off?
Anyway, so just to say that the funding is definitely coming from health, and it's on its way.
Okay. I think I've got on film the health sector saying that at the last but 2 meetings. So I guess I need a little bit more reassurance. So what frustrates me with this is wrapped up in another conversation, a bigger conversation about money, which possibly happened earlier on in the meeting. So I would like to detach this relatively small amount of money from that big debate. So what I don't want to be in a position of is saying to the public that their GPs are not interested in this particular area of work, because that's not true. But money, people generally follow their money. So
I've just committed that the money's coming. So so that's already been said, hasn't it? So if you're saying please commit that the money's coming, I've already said that.
But sorry, Chairman.
I've heard it said.
Okay, but we have heard that said before.
Let's not. Can I ask a specific point? I think this is what you were referring to. 4.5 in your report makes each housing authority could bid for up to 100k per authority. The total amount available on this bid nationally is 10 million. You mean we could actually have 700,000?
Yeah, Andrew, go.
Well, in principle, we could bid for, or each housing authority could bid for up to 100k. If you do a rough calculation for what Northamptonshire's fair share would be, it'd be rather less than that. It will, of course, be a matter for the housing authorities, and I'm delighted by the way that those authorities are collaborating and coming together. And I believe we'll be pitching for rather more than a kind of pro rata for Northamptonshire's allocation, but at a level which is likely to be achievable. So that will be decided through the bid process, but hopefully we'll be in a position which means that we're able to deliver the strategy we've been working on during the year.
I think the concern we've had is that we still haven't seen a housing strategy from, you remember 12 months ago we said that they were going to try and do that through the university. I don't know if Carol has any comment to make on that, because this should form part of it, of course.
I'm afraid not, Chair.
Okay. Any further questions for Adam? Karen?
Sorry, just on the housing, Chair, within the local authority we are looking to do an accommodation strategy, and we are linking with Northampton, also linking with Chris, and Chris and I have had a conversation outside of this meeting about how we can move that on. So the intention is that a draft document will be available to me in the next couple of weeks, and I'm more than happy to share that with the board once it's completed.
Thanks very much indeed. Okay, there aren't any further questions on that. We'll go on to the next item, which is, Hakim, yours, D3.
Thank you very much, Chair. We've got about 10 or so minutes for this, so I'll only speak for a minute or so that we have a fuller conversation. If you cast your mind back to the last board, we had a conversation when Kettering General Hospital presented some of the work they were doing around their 5-year strategy and the health and well-being campus ambition, which led to a very welcomed common agreement around the table that this seems to be something sensible that we should do across the whole county, where all employers look at how they improve the well-being of their staff. At that board meeting also, we know that different organizations have been doing similar pieces of work in small, large scale across the system. And what we agreed as a board was to look specifically at how we can do this consistently and systematically across the county. So with that, we looked at the work that was ongoing in Kettering as an example of what we could do, I suppose, in a setting where you would at least expect something around prevention, because catastrophic illnesses and urgent care is one major thing that acute hospitals focus on straight away. How can we build prevention into that, both for patients, their carers, their families, as well as the workforce? So what we've done, working with the specialist agency that we had, was to look specifically at some of the ingredients of how that worked in Kettering General Hospital, pull that together into the 7 areas of work that we've highlighted in this paper, from leadership all the way to how you do staff engagement and communications. That is one experience locally, and is based on the evidence that is also available internationally and nationally. We know that people have other experiences locally, so it would be great in this conversation to see how we can add to this list of the things that we think are the ingredients to success, what's necessary and sufficient to success about what we want to achieve. From then on, we can then create a program that both public sector, private sector employees, small or large employees, can adopt as a systematic approach in Northamptonshire. The second thing I wanted to bring to the attention of the board is there are a few papers that have been sent around which essentially looks at some of the key behavioral issues or risk factors to health and well-being that we can do something about. And having looked at the evidence of what works, what can be done in this kind of approach, we've set out some of that in that A4 paper that you've got passed around to you. That is being developed further as each of the different issues arise. It would be great if we can tailor that to each organization, both in terms of the key issues for their staff or their clients or the part of the community that they serve. So overall, the recommendation we're making to the board is to formally adopt the program, because you've asked us to go and work at the last board to see how we could, implement this. So we're asking for the board to adopt the implementation of the program. Secondly, to give specific support to the Healthy Hospital bit of it, as well as the larger Healthy Employer program. Undoubtedly, there will be conversation about resources and how do we make that happen. And I'm taking the liberty of proposing to the board now that we could have a very specific task and finish group to help make this happen and happen quickly, because as we were talking earlier, we want to raise aspiration about how we actually improve the well-being of people in our county. I'll pause there. Thank you, Chair.
Questions, queries? Will?
Thank you very much. Happy to support the Healthy Employer Programme, support the recommendations, support the Task and Finish Group. Happy to join it.
Oh. You can't have too much of a good thing.
Darren?
Yes, I completely support this, obviously from a clinical perspective. Were you intending to tailor the advice, more so, because it's sort of fairly generic, but actually give phone number, local numbers of local services? And
yes, exactly. And what you've got here are drafts in terms of the program that is ongoing in catering. There's a combination of, do you use it as, the general information for everybody working in that organization and any specifics. So we would like to develop with each organization, particularly large employers sitting around the table, what would work in your environment, knowing that this is generic evidence. How do we actually use it for your bit of the system? I suppose I must say, we would like to do this with everybody having a skin in the game, rather than, it's those people who are doing it, and it would be really powerful. And I'm really excited about the fact that I'm getting agreement across the table that we do it for each organization, owned by the organization. Yeah.
Jonathan?
Thanks. Like everybody else, I support the programme. It would be great to get everybody healthier. One of the concerns I have about the advice regarding exercise, which is considered one of the key, probably the top thing that people can do apart from not smoking, is that the level of exercise recommended under NICE is actually quite high. And I think for many people might be unachievable, certainly for elderly patients who come and I'm trying to offer them that. And is there any evidence that that level of engagement is achievable? Would it be more appropriate to try and tailor it at a lower level that people would engage with better, do you think?
Akin?
Talking about evidence, what evidence is, that's the optimal level of exercise. However, any exercise is good for you, as I found out. So, actually, just being active is a good starting point. And then the more active you get, the easier it becomes for you to actually attain that optimal level. And so, you're right. One of the things we have to look at carefully is when we tailor the advice to particular client groups and population groups, that we make sure it's something that they can do, because success begets success. And there are various elements of those advice for particularly older people in terms of, muscle strength exercises and walking and all of that. You're absolutely right. Yeah.
Graham, as you're the hospital quoted on all of this, is this something that presumably you're now involved in developing this on site?
Yes. Yes, we are. Obviously, this uses us as a bit of an exemplar in this issue. It is part of where we want to go with our staff, and it is an intervention which we think will help patients going forward as well, if we can lead on these sort of matters going forward at a ward level, not just at a board level.
So the board really should question the other big employers around here, which is the NCC and the NHFT and the clinical commissioning groups. How will you actually make this happen if you haven't got any money?
Shall I go first?
Yeah, please.
My previous life experience, where I have encouraged people to take exercise and to introduce classes, as well as what we're doing in NHFT, it doesn't actually cost any money. And I think that's an important thing to make to all employees. It doesn't actually cost you anything. You might provide a meeting room of an evening where somebody will come in and run a Zumba class or a yoga class. You might encourage people to cycle to work, so you put some racks up. Well, okay, that might cost a few £100s, but we're not talking big bucks. And it, generally speaking, will deliver in a happier, healthier workforce, which will have less sick leave. They'll be more content at work. And my previous experience in where I've introduced sort of practices which would encourage people to exercise and drink less paid huge benefits. So I absolutely sign up to
Thank
this
you.
and very happy to do so.
Well, from the university point of view, fully support such programmes. We do at the university have a health and wellbeing strategy, which is led by our HR department, and we have bikes that go between both campuses. Most of them end up down at Avenue campus, not at Park campus. People prefer to ride downhill than uphill, I think. Yes, fully support this and happy to be involved in whatever task and finish group is necessary.
Will then, Martin.
Yeah, thanks. Just in supporting Paul's point and helping Jonathan as well. I mean, there is a strong evidence base, particularly for the workforce, I have to say, which wasn't quite what Jonathan was asking, I realise. But I could just point you to the University of Sheffield, where there's a 9-year research programme there, and currently they've got 500 members of staff at the Sheffield Teaching Hospital in a wellbeing programme. But actually, the expense is not really capital equipment, or it's actually a cultural change where the biggest return on investment is, and that just starts off with a 2-hour sort of one-to-one interview. But changing, if you like, the perception and dynamics of lifestyle choices as the beginning. So, yeah, the evidence is there, but happy to help if you need it.
Thank you. I've got Martin, then Dominic.
If I just may say to all the large employers around the table that in respect to mental well-being, employers often invest in an employee assistance programme or something similar. If you don't, I'm sure that BUPA or AXA may be knocking on your door. And in listening to them, also, could you listen to the voluntary and community sector who may be in a position to provide those services?
Okay. Dominic?
Totally supportive. I think the practical idea as well around getting teams to have objectives based on that, I think, would be something that we could perhaps look at to move it forward. Just a plea, can we start it probably after Christmas? Because personally got some alcohol and sort of food planned over the next couple of weeks, but I'll leave that for a board decision.
So, any comments from the CCGs or the police?
Yeah, just to say, we're certainly supportive, and we're not a big employer, but certainly we take our responsibility in terms of if we're promoting health, and that's at the heart of some of the health and Northamptonshire strategy. That's really important that as an organisation we're leading on this. So, yeah, very key.
And the police?
Apart from myself, everyone in Northamptonshire Police has to take a health test, which is a statutory responsibility. It doesn't apply to me.
Good. Well, I'll use the opportunity now to say that sadly Peter Wojcinski is no longer with us as a board member, but as you may know, he took the challenge of losing weight, and he has, in the period when he spoke to me last week, had made a 5-kilo reduction in his weight from the September weigh-in. And as always, having demonstrated that one can actually take an obesity programme and achieve something from it, what I'm really looking forward to is finding a way to use this board to demonstrate the benefits. Now, there are 2 challenges here. One is I need somebody around here to take on from where Peter gave up. And was that a nod of acceptance, sir? And the other one is this dry January month, because there's a thing in here about alcohol misuse as well. So I think that by email we must find somebody to join our programmes so we can demonstrate that. Yes? Yeah. Well, it doesn't start until January.
Enjoy the festive season first.
Absolutely. There we go. Well, Suresh, if you're prepared to, and you don't have to be weighed today, we'll organise for you to be weighed by Akim's team in January, right? And And Suresh, you can come to us and demonstrate how, from this point of view, we're actually doing something. Hakim, to final point.
Thank you very much, Chair. I think shamefully I must say that within NCC we still have quite a bit of work to do also. But just like Carol said, at the university we've got somebody in the HR department working with other colleagues to create a program for us. We've just introduced a new cycle to work scheme within the organization. I've got some of my colleagues with more dulcet tones than myself in singing choirs at the moment, trying to get ready for the festive season, all good for well-being. But I think looking consistently at a program like this would be really, really helpful for us and create something. So we will be achieving people along post-Christmas and in the new year to get more members on the task force. I've got Will and Carol. Thank you very much for your volunteering. And I'm sure we will need further colleagues across the table, particularly looking within the NHS and the voluntary sector, to join us to have a fuller conversation about how we can take this round the county. Thank you very much.
Thank you for that. Sorry, we've been asked to know if we'll move on to the next item. Okay. The next item is actually the Mental Health Concordat, which, Andrew, you've produced a paper. Would you like to very briefly be available to take the questions? And will you be making a comment about the letter that David Smart received?
Yes. As a follow-up to the board meeting we had in September, developing the action plan, we have been joined by Jim Simonton, who's the national lead on the Mental Health Crisis Concordat. He advised us that, in line with many other authority areas, we could submit our declaration, given that we had agreed the principles, and in doing so, we've now reached a stage across pretty much the rest of the country where we are amber. There's still a few red authority areas. There's a small number of greens, but we're now very much in line with other health and social care and wider partnership economies. And as a result, David Smart, who was one of the many people who collaborated and joined our two workshops, has received a personal letter of thanks from the Minister, Norman Lamb, and he's asked for that to be shared for all the other signatories to the Concordat Agreement.
If I could, I'd just make the point. This was on the 10th of December, and in fact it was from Norman Lamb to David Smart. And for those new members of the board, David was a member of the board up until earlier this year when we did the configuration change. And he draws comparison to the excellent work that he's been involved in and thanks him for his leadership. He pays tribute to Peter Lynch and the Health and Wellbeing Board Business Manager for getting ourselves to this stage. So, Andrew, you and your team are to be congratulated. And a little personal note at the bottom is that he's offering his help to continue driving this action plan forward. So, if we want Norman Lamb to get on side, we've got the personal invitation. I hope somebody will follow it up. Sorry, I don't think there are any queries. That's now in the public domain, and well done for achieving that. Thank you. Okay, we'll move on to the next item, which is Hakim, the pharmaceutical needs assessment. Is there something on there we should be doing? Is that it? Right.
Thank you very much, Chair. This is one of the statutory duties of the board. We are meant to produce a joint strategic needs assessment, of which one of the component parts is the pharmaceutical needs assessment. The paper outlines the background, the process, and the draft document that you've got, which, as board members, it would be really, really useful if you could comment back, both in terms of the content, the context, and other issues that the paper might not have picked up that you would like to be further explored. I must at this juncture say that this is very important to a lot of our partners in primary care, particularly our community pharmacists. In a way, I can characterize this as this is what determines whether you can set up a pharmacy business in a particular locality or not, based on needs. So it does have quite a bit of commercial sensitivity to it. It also has legal implications to it, because before you can go to NHS England to get an approval for your plan to create a pharmaceutical outlet in a particular area, you must be able to demonstrate that the need exists. And this is what clarifies what that need is. So we see a lot of documents that it's important to just know the broad stroke of it. This is one where people will score over every single detail of what is said in here because it does impact on business. That's one element. But the second element is it also impacts on our strategic direction of travel locally, where we want to move the experience of patients into a seamless one, where everything you could do to support your care is done at as close to your community as possible, of which pharmacists play a very, very significant role. And in developing that role further, this document also outlines some of the opportunities for that to happen, both in terms of what services are offered, could be offered, should be offered, and how that is linked into social care, GP services, acute care services, and beyond. So in many ways, this document is a valiant effort to both create a market as well as meet needs for our communities, and is aligned to our strategy. So I will be enjoining you to have another look at it. There is a consultation period that is formal that we need to contribute to. And each member of the board, when you do post your feedback, please kindly note that you're a member of the Health and Wellbeing Board in that feedback. So there's an email that will go around again just to remind you in terms of where the link to the documents are and the consultation feedback process. If I take a pause there.
Right. I've got Chris.
Thank you, Chair. On page 9, recommendation 1, about there's no immediate increases needed at the moment in terms of the number of pharmacies. I think one of the things we're looking at the moment is the actual planning gain that the NHS or health services get out of the growth of Northamptonshire. And I was speaking to the head of GP Premises England not long ago, and she was making the point that she reckons obviously education and highways come before health. And I'm just wondering whether we, the health in general, is getting enough out of the growth agenda. We are talking to the NHS direct on this, because I think one of the things I say about the community hubs is very, very important. We're looking at, some around the table know this, we're looking particularly at the new GP surgery, but it's not just a surgery, it's about the health hub. And in that health hub, you would expect to see a pharmaceutical facility. And it's about the joining up again. This is why I was talking about the premises early on. It's about this joined up approach to trying to achieve the best out of what we have. But I think that's quite important in terms of the growth agenda in Northamptonshire, because we've got tens of thousands of houses going to be built across Northamptonshire in the years ahead. That you maximise the potential out of that growth with Section 106, SIL money, whatever, to help you take this forward. Thank you, Chairman.
Well, take them at the end. Will?
Yeah, thanks, and support Chris's points there. And actually, I'd like to just reference us to, it's actually on page 110, Appendix 10, but there's a detailed response from Healthwatch there, which I'll not go through. But when you read it, you also notice that the results of our work shows how popular pharmacies are, how people like them, how in actual fact if they're used more because they're better and more joined up, they could actually de-stress the system a little bit without rehearsing the agreement the discussion we had earlier. So we'd support actually, even though the recommendation I realise says don't need any more. I think I'm with Chris really, but not only do we need more, we need more, bigger, better, joined up. And I'm just conscious that they're not always joined up at the moment in terms of medical records and whether they're assessing the right population and that sort of thing. So I'd like to support it, but I'd like to get that right as well.
Okay. Akim, would you like to... can we take... No, we'll take Jonathan, then Akim can
Thank you. I'd like to follow on from that. Just a couple of specific points. You've obviously done a lot of work on this, Akeem, and there were particular issues around, you've mentioned GP dispensing, which a lot of people won't understand the difference between a pharmacist and a GP dispensing arrangement. As you rightly put in your report, many patients like GP dispensing. It does provide that one-stop shop facility, which is good. You have commented specifically, though, about the problem of electronic prescribing not being available in many GP dispensary surgeries. And as we discussed earlier, I was surprised that you said that 14% of GP dispensing practices actually do provide that. The problem is that you require computer software that links in with your system to be able to do it. And the current main providers of GP software computing do not provide that because there's an impasse at government level about who will develop that software. The companies themselves said that they're not prepared to put in the funding because it's a government initiative, and the government say that they won't do it because they want the GP software companies to do it. So I would ask for the support of the board and any pressure we can put on to try and unblock that impasse so that GP dispensing practices can also provide electronic prescribing, which is good for patients, easy for patients, and certainly easy for doctors too, frees up their time to get on with other work. So that would be an important thing we could try and move on if we could, and get them to at least the level of pharmacy, if not 100%. The second issue was around, as Will said, around the joined-upness of the provision of services within pharmacists, and the issue of access to records and treating the patients in an appropriate way. And the most obvious example of that is around provision of flu immunisation. At the moment, the numbers provided in pharmacies is relatively small. Most patients will get their flu immunisation through a GP practice, so a vast majority, we're talking probably more than 90% will go to GP to get their flu immunisation based on their patient record and the GP's knowledge from that database of who should get that provision. The problem at the moment, as I understand it, and we discussed this with the area team, is that potentially patients could go to a pharmacist, say, I am eligible for a flu vaccination, and receive it because the pharmacist is not able to say whether that's correct or not. And of course, that's probably not appropriate. The flu immunisation programme is meant to be directed at specific groups, and that would be what happens within a GP surgery, and they would be invited on a recourse system and try and keep a number on the levels. That doesn't happen so far in the pharmacist. So there needs to be some sort of streamlining so that the system works as a whole to provide the right care, and also not destabilise the massive amount of work that takes place in general practice surgeries, because GPs have to buy that vaccine a year in advance. They need to know roughly how many they're providing. If the provision spread, it could destabilise the whole system and make it actually work less well. So we need to keep those things in mind.
Thank you. If you respond, please.
Thank you, Chair. I'm bound to invite my CCG and NHS England colleagues into the conversation. But if I just set out one or two things in terms of the questions. I think the very first task is for the needs assessment to highlight, do you need more outlets? The clear recommendation is probably not. But do you need them to do things differently? The answer is definitely so. Now, what to do differently has to align with the Healthier Northamptonshire programme, the health and wellbeing strategy, the planned future growth in the county, the reorientation of the population, the integration ambition, which I believe passionately in, and I think is set out somewhere in the report about, actually that is a key task for us rather than brick and mortar around building more outlets at the moment. But it could be, of course, if you want to change the way people produce and deliver services, that you then actually need new brick and mortar. There's a complicatedness in that you've got private enterprises as well as quasi-public enterprises providing those services. So the commissioners, I'm not envying them in terms of how actually the strategic ambition is linked to the need in the county, and I'm sure Dominic would highlight more about some of the commissioning arrangements that has been discussed. Thanks for the compliment, Jonathan. I will make sure that the team, get that directly from me. It's been a lot of hard work. There's been a lot of consultation, both for the pharmacists themselves as well as patients and carers and all of that. And I think you're right. Your surprise is a positive one, I imagine, because you probably thought it was 0% in terms of electronic prescribing. When I saw the figure too, I was kind of like, "Ooh, that's a good start." But we could do a bit more. And I believe that's probably another conversation in terms of commissioner rule around if this is really critical to having that joined up service across pharmacy and GP practices, do we need to invest in it locally? But then, of course, that is much dependent on how much money we've got in the system and what other priorities are. So, essentially, the task to outline the need to see whether we actually immediately need to meet some shortfall in terms of numbers says, no, we don't. The task is to change and reintegrate and remodel what those services do as far as possible.
Thank you.
Just a couple of comments. I mean, in relation to community pharmacy, as Jonathan alluded to, we have commissioned community pharmacy and opened up the market for specific target groups this year. So within the report, there are more patients, so it's nearly 800 patients that have been immunised locally from community pharmacy that weren't. So there has been an increase, but it's only in specific groups. So that was the agreement that we had at the beginning of the year. I think as we move forward with co-commissioning and localities, we need to then look at the areas with the lower uptake and then say, actually, how do we potentially target within some of those populations? And I think that's the next automatic step in terms of working locally with GP practices in areas, but there are clear variations across the patch when rates are higher than others, and that's what we need to address through the work we're doing. So we have made the start, but I think there's a lot more we can do at a locality level.
Thank you. Okay. We'll move on in that case to B1, which is a paper that Nick has produced for us on the Social Value Act. Perhaps, Carol, you'd like to briefly outline any particular points, Nick, about.
Okay. Yes, thank you, Chair. This is follow-up from a workshop that we had at the university in August, addressing some of the challenges and opportunities of the Social Value Act and social impact. And I think what came out of the workshop was that there is lots of experience and expertise across the county. The organisations generally are aware of the Social Value Act and the opportunities and challenges that produces. But perhaps one of the issues is the measurement and the evidence that those organisations are actually taking that into consideration and measuring their social impact in what they do. As a result of this paper and the workshop in August, we are suggesting, which is not on the recommendations, I apologise, that we have a second workshop to which we invite all those that are interested in developing a common social impact framework, which I think is mentioned at the end of the paper, and looking at different means of measurement of social impact. So that's our recommendation from the paper.
Thank you. Okay.
Chair, I'll definitely support that, because I think one of the challenges we have, particularly when we look at the voluntary sector, is that there's a lot of work that is done there. There's a lot of assets and resources that we can lever into the county that we haven't been able to capture the impact in a way that really stimulates, further resources coming into our county and link public sector and private sector plus. So we've asked the university to look at some of that elements also.
Okay. I'll then, Martin.
I'm aware that the Community Foundation has done a big piece of work on this, which I think the board should be made aware of. Jane, do you have some more?
Yeah, just to say, I went to the launch of the Community Foundation Social Impact report. There's actually a really big report. And what they've done is they've created a framework with, I believe, someone from the university as well anyway, that they're using for the grants that they're delivering. And I think if you use that as a base, there's actually a really, really good base there that's been looked at by national community foundations. So Northamptonshire is being recognised as a leader in this, and that should be taken into consideration in anything we're doing, really.
Thank you very much. Thank you for that, and I'm sure that will be noted. Can we move on to item B2, which is Rosie, if you'd like to join us, please. Your paper has been published.
Okay, thank you, Chair. Welcome the opportunity to present these principles. I think they really build on what is recognised good practice in patient and public engagement, and they particularly draw on practice from the mental health movement, particularly the National Survivors Users Network, the 4 principles for impact. And I think it's very timely, bearing in mind the conversation we had earlier, or you had earlier, around healthier Northamptonshire, and I think Eamon highlighted the need for robust public engagement. I think what the principles really offer is an opportunity for us in the county to demonstrate that commitment and to really create a shared understanding of what good engagement looks like, and something against which we can benchmark activity. What I would say is that I think it requires quite a fundamental shift in approach from health and social care partners, Healthwatch Northamptonshire, together with the voluntary community sector, which is very rich in the county, is here to help, to guide, to assist in that activity. But it does require, in my opinion, and I think in the opinion of Healthwatch, quite a fundamental shift in approach, better planning, better timetabling, and I think moving away from a culture of we've made a decision, what do you think, to engagement at the start, and I mean the start of a change process. So I commend the principles to you. They're short and simple. They're on one side of A4. There's some practical suggestions attached as appendices. Welcome debate, challenge, scrutiny, because I think that always enhances the final output. Thank you.
Yes, I'm still on. The recommendations have a interesting suggestion, which is that health and social care partners are asked, subject to approval, to demonstrate how their organisations will actively implement these principles. So we're round the board table now. Are we actually suggesting, therefore, that we would wish to demonstrate how we are actively implementing these principles? Alex.
Can I just make what I hope will be a helpful suggestion? So for those of us that are providers of large-scale services, user engagement and involvement is a key part of what we do, and we have processes, reports, all that kind of stuff that articulates that. And I think, if possible, rather than do something different, if we can point you in the direction of that, where we've got it, that should answer the question and minimise the need for additional things to have to be done.
That certainly turns it on its head, and effectively is suggesting that you are invited to look at what is actually being done within each of the organisations. How does that sit with you?
Well, I think we're already doing that, and if you take the example of the work that we're doing with NHFT around the Transformation Board for Children and Young People, we're looking at how we can join all the dots on engagement, because there is a tremendous amount of engagement going on at the moment with children and young people, both through the County Council and also through commissioners and providers. And what we've done is to do some mapping with NHFT and the County Council to set out what's already in place and how it can be enhanced and supplemented. So rather than setting up new or additional structures, actually we use what's out there. So absolutely, I think that fits entirely with what we're proposing.
Thank you. And therefore, would it not be appropriate to suggest that maybe you provide us with an update in 3 months' time as to what progress has been made in terms of people accepting or understanding the principles as you've laid out?
Yes.
Would that be acceptable?
Yeah.
Yeah. We are committing ourselves. Yeah? Excellent. Thank you. Will.
And may I thank everybody for that, but also invite you to commission us to do that. So perhaps we could have a discussion about that with each, feeling like couple of days' time with everybody.
Yes. Well, that's an interesting point. As we discovered many, many moons ago, as the board doesn't have the access to any funding whatsoever, it is only an influencing organisation in that instance.
Support from the board with each organisation would be great. Thank you.
Well, I think that's what we've given. Okay. On the agenda, sorry, Paul.
Sorry, before you move on, just a question of clarity, really, around the engagement from the very beginning as services are being redesigned. Very often in the very first stages, we're sitting down with our colleagues in health and social care to talk about the art of the possible. And it's only when you actually get to the point of actually determining what the art of the possible is that you can start engaging. And I think to engage right at the very beginning, which is what's implied here, would be very difficult. But to engage once we have some thoughts and ideas, which are getting some clarity, is reasonable. And I think that fits nicely with what you're proposing in terms of working with us and identifying where we could do more. That's the only thing. Thanks.
Thank you for that. That's most helpful. Rosie, thank you very much indeed.
Okay, you're welcome.
As you know, the next items are effectively reports which are presented to the board, and normally I would invite either comments or additional comments, but on the basis of where we are with the time, I will suggest that those are done either by email individually, or if there's a burning problem, then you talk to me after the meeting. We move on to the final F1 on the papers. We have an issue concerning the Health and Wellbeing Board self-assessment, and in the past we have discussed this, and Akim, would you like to make some comment? I know that we've got a paper.
Well, it's a very simple one, actually. There is a process that we are proposing to the board, which Andrew could basically highlight, because I think the paper has gone round to board members to comment. Yeah.
Yes, we placed it as an AOB because of the agenda. We obviously want to have a work plan for the Health and Wellbeing Board to make sure its structures and its processes are as effective as possible. One of the ways of doing that is by self-assessment. We're proposing a particular tool which has been put together by APSI, and if we go ahead, of course, we absolutely invite your contributions to it. So you can expect that we'd be emailing you and asking you to comment as far as you're able to. The only point to make around this particular tool is it's very broad. So it's thinking about health and well-being and our partners and our resources and our leadership ability in the widest possible sense rather than a narrow sense. And that's why we're recommending it as the approach we use for self-assessment.
I think it might be appropriate at this time to mention Rob McLaughlin.
All right. We've all through today have conversations about a lot of really large transformational actions we want to take locally. A lot of it is dependent on cultural change, behavior change, and also taking the community with us. And the point Rosie was making in the paper earlier on is about engaging people, both in terms of creating solutions and also exploring solutions. And one of the things that we've been discussing is, as we get clearer about our ambition, the operations we want to put in place, the kind of things that we want to explore as out of the possible, we do need some large-scale communication with our public, exploiting and exploring all the mass communication channels that are there, the traditional ones, radio, TV, newspaper, as well as social media, as well as other innovative ways of working. As organizations, we're doing that independently to an extent. We're doing that collectively, sometimes around the Healthier Northamptonshire program on specific issues. So what we're proposing to the board is to actually look at the opportunity of pulling together all the aspirations we've been discussing today and some more into a program of work with support from media consultancy, with local communications people, to look at how could we create this buzz in Northamptonshire that creates a set of agenda that our public want to buy into, using expertise that is already in the voluntary sector as well as in the private sector. So one of television personality that has worked on the Granada TV, I think the guy is called Jeremy Paxman of the North, was having a conversation with some colleagues across the system, and he's come to talk to us that as a Health and Wellbeing Board, if we wanted to explore understanding how our impact on the media is and how we're using our traditional media locally, it will be happy to offer us their services. So we thought we should bring that to the board and mention it to the board if people are interested in exploring that. I'm getting a nod of assent. Yeah. So we would invite him, to come and talk to us about how we could actually use. He's got a lot of contact with the BBCs and the ITVs and the Skies of this world, which might be powerful for us to explore. Thank you.
He will make contact individually as well.
Oh yes, he will make contact individually with all of you once we've said yes, we want to do it. Yeah. So he doesn't come, uninvited, so to speak. Yeah. Thank you.
Fine. The other item on the agenda is there's a list of dates which have been put forward. They don't make clear to me which are the dates of the formal public meetings. Peter, we've got a list of dates which go from today's meeting, which is the 18th of December, then it's got 12th of March, 18th of June, 17th of September and 17th of December, which I presume are the formal dates, and then the following dates underneath that are the dates for development days? Yes, fine. Again, one hopes that we could have the maximum attendance, but like all organisations, we need to set the dates. They've been taken into account various problems that individuals have, and we will publish them again after today with the minutes so that you have the opportunity of at least looking at next year's calendar and using them. Normally, the final, that would be the final point. The final piece, of course, is the take-home messages, where I have the opportunity, where I normally would have the opportunity of inviting somebody to give the outline of what they believe the take-home messages were. And I do know that I've been most unkind in the past of not warning people beforehand. And I think it's not something that I should do for Christmas. So I think that in that case I should deal with it myself. I think that on this occasion, on the basis that we've actually allowed what was the longest period of time for any debate to do with the Better Care Fund, has proved to be very useful. Useful on the basis that there was some information that I gained that I hadn't been aware of. Useful on the basis that there are some points and comments that have been made which clearly identify that we haven't got the answers to a lot of the problems going forward with the Better Care Fund. But I was taken by some words which are said which were to do with the fact that the programme from Healthier Northamptonshire needs powering up. Interesting description. And also the point that was being made about the benefits that could come for our health system and social care system to look to twin with another more integrated system elsewhere in the country. And I think the challenge would be to find that and to understand how that could be of benefit. Because if there is something to be learned by others, why try and invent the wheel ourselves? And I also take this point about the engagement with patients and carers, because although we have talked about it and we have highlighted again a commitment through what we've just been talking about with Rosie, the concern I've got is with Healthier Northamptonshire, where are we in terms of how we really are engaging with the public and with our patients? And I know each part of our organisations are doing their bit, but it's how we bring that together as a whole. And it does demonstrate perhaps the difficulty we've got, that we have so many people have a responsibility within this area. And in truth, there's only this ward where we all sit round it without any statutory responsible to go and do something. But on the other hand, we do have a duty to come and to. Yeah, I'm looking at NHS England because he probably has greater control over money than some of us have. But those to me were the main issues as I saw them. It's very easy to be very negative. It's very easy to be very critical about the fact that we've taken what seems to be a long time to come to an agreement. I think we should celebrate the fact that we now have got an agreement. I think we should celebrate the fact that at least we've got the basis of working together in a way which can give us a better outcome for the patients and the people of this county. And that's what it's about. And we can only do that by working together. So without final ado, I wish you all a very Merry Christmas and a Happy New Year, and I look forward to seeing you all in 2015. And that I will close the meeting 5 minutes late.
Yeah,
Thank you.